Continuing with Chapter 4, Objective 3, we're going to define, pronounce, and spell disease and disorder terms related to the integumentary system. So the first set of terms are built from word parts. So again, they're going to have a prefix, suffix, word root, or a combination of all of those. So these are the easier terms to translate and define. So first of all, dermatitis, inflammation of the skin. Dermatoconiosis, abnormal condition of the skin caused by dust. Dermatofibroma, fibrous tumor of the skin. Hidradenitis, inflammation of a sweat gland. Keratosis, abnormal condition, growth of horny tissue or keratin. Lyodermia, condition of smooth skin. Onychocryptosis, abnormal condition of a hidden nail, also called an ingrown nail. Onychomalacia, softening of the nails. Onychomycosis, abnormal condition of a fungus in the nail. Onychophagia, eating the nails or nail biting. Pachyderma, thickening of the skin. Paronychia, disease state around the nail. Seborrhea, discharge of sebum or excessive amounts of sebum. Xanthoma, yellow tumor, benign primarily in the skin. And xeroderma, dry skin. So here's just a note when we're looking at the term paronychia. It just says the A from para has been dropped. The final vowel and a prefix may be dropped when the word to which it is added begins with a vowel. And that was one of those rules that we learned in chapter. Here is just a couple of review questions. These are in your book as well. They're giving us the definitions of the word parts and we're going to create the medical term for them. And I think the book tries to find the most graphic picture sometimes. But let's go ahead and get started. Okay, the first one, nail. We learned in chapter 4 that there were two combining forms that mean nail, either onycho or unguo. So we're just going to make a note of that. Then you have your combining vowel, which is more than likely going to be the letter O. And then we learned that myco was the combining form for fungus. And then abnormal condition, that actually came from chapter 2, osis, O-S-I-S, was abnormal condition. So your two choices, again, for nail was unguo and onycho. And this was one of the terms that we learned just a few minutes ago. Onychomycosis is abnormal condition of fungus in the nail. And then the next one, around nail disease state. So para was a prefix that meant around. Nail, again, could either be onycho or unguo, and then disease state was the suffix ia. Just like in this scenario right here, the A from para has been dropped. So when you create number 2, paronychia, you're going to drop the second A from para, and it's going to be P-A-R-O-N-Y-C-H-I-A then. And then the A ending. We learned that sometimes the suffix just A is just a noun suffix. There's no meaning. So here are some terms that end in just an A. Again, it's just a noun suffix, has no meaning at all. So here's just an analyze and define. We have the term onychomycosis. Again, when you break it up, always start with the suffix. Again, here's the abbreviations up here. So osis is the suffix, which means abnormal condition of fungus in the nail. Again, here, if you did it exactly, abnormal condition, start with the beginning would be nail, and then myco is fungus. So they're flip-flopping those two words. But again, either way, it still makes sense. You can easily determine what the patient has either way, so we are good with them flipping around nail and fungus. It's okay. All right, so now let's look at disease and disorder terms that are not built from word parts. Again, when something is not built from word parts, you're just going to have to memorize them. There's no other way around it. Again, lots of good pictures and lots of disorders and diseases out there, so let's go and get started. Abrasion, scraping away of the skin by mechanical process or injury. Abscess, localized collection of pus. Acne, inflammatory disease of the skin involving the sebaceous glands and hair follicles. Actinic keratosis, precancerous skin condition of horny tissue formation that results from excessive exposure to sunlight. Albinism, congenital hereditary condition characterized by partial or total lack of pigment or melanin in the skin, hair, and eyes. Again, congenital just means that they were born with it. Hereditary means it's coming from their parents. Basal cell carcinoma is abbreviated capital BCC. This is a malignant epithelial tumor arising from the bottom layer of the epidermis called the basal layer. Candidiasis, infection of the skin, mouth, also called thrush, or the vagina caused by the yeast type fungus Candida albicans. Carbuncle, infection of skin and subcutaneous tissue composed of a cluster of boils or furuncles caused by staphylococcal bacteria. Cellulitis, inflammation of the skin and subcutaneous tissue caused by infection, characterized by redness, pain, heat, and swelling. Contusion, injury with no break in the skin, characterized by pain, swelling, and discoloration. It's also called a bruise. Eczema, non-infectious inflammatory skin disease characterized by redness, blisters, scabs, and itching. A fissure is a slit or crack-like sore in the skin. A furuncle, painful skin nodule caused by Staphylococcus bacteria in a hair follicle, also called a boil. Gangrene, death of tissue caused by loss of blood supply followed by bacterial invasion, which is a form of necrosis or death. Herpes, inflammatory skin disease caused by herpes virus characterized by small blisters and clusters. Impetigo, superficial skin infection characterized by pustules and caused by either staphylococci or streptococci. Infection, invasion of pathogens in body tissue. An acute infection may remain localized if the body's defense mechanisms are effective or may persist to become subacute or chronic. Kaposi sarcoma, cancerous condition starting as purple or brown papules on the lower extremities that spreads through the skin to the lymph nodes and internal organs. This is frequently seen with AIDS patients. Laceration is just a torn, ragged, edged wound. A lesion, any visible change in tissue resulting from injury or disease. MRSA infection, invasion of body tissue by methicillin-resistant Staphylococcus aureus. Pediculosis, invasion into the skin and hair by lice. Psoriasis, chronic skin condition producing red lesions covered with silvery scales. And a few more. Rosacea, chronic disorder of the skin that produces erythema, papules, pustules, and abnormal dilation of tiny blood vessels occurring on the central area of the face in people older than 30. Scabies, skin infection caused by the itch mite. Scleroderma, disease characterized by chronic hardening of the connective tissue of the skin and other body organs. Squamous cell carcinoma, malignant growth developing from scale-like epithelial tissue of the surface layer of the epidermis. Systemic lupus erythematosus, chronic inflammatory disease involving the skin, joints, kidneys, and nervous system. Tinea is a fungal infection of the skin. This is also ringworm or athlete's foot. Urticaria, itchy skin eruption composed of wheals of varying shapes and sizes. And vitiligo, white patches on the skin caused by the destruction of melanocytes. Again, the book has some great pictures and lots of exercises for more practice. So here, I forgot to make this the answer pop up separately, and I apologize. But basically, name this malignant epithelial tumor arising from the bottom layer of the epidermis called the basal layer. It seldom metastasizes or spreads, but invades local tissue and may reoccur in the same location, and that is a basal cell carcinoma. And again, that abbreviation is BCC. And then this malignant growth developing from scale-like epithelial tissue of the surface layer of the epidermis. It invades local tissue and may metastasize or spread, and that is a squamous cell carcinoma or SCC. And then just some common skin infections. Again, infections can be caused by bacteria, a fungus, a parasite, or a virus. So bacterial infections, some of the common ones are your carbuncle, cellulitis, furuncle, impetigo, MRSA infection, and paronychia. Fungal infections are your candidiasis, tinea, and trichomycosis. Parasitic infections are scabies and pediculosis, and viral infections are your fever blisters, which is herpes simplex, and shingles, which is herpes zoster. And one more question. So what is the superficial skin infection characterized by pustules and caused by either staph or streptococci? And again, just go back. These are all not built from word parts. So hopefully you chose A for impetigo.